Hi everyone, today I'll be talking about effective human resource strategies in public health organizations. My name is Michelle and I'll be the narrator for this presentation. Our group comprises of Carla, Juliet, and Catherine, who all work for the Region of Peel, Salmon, and myself, and I work for KFLA Public Health in Kingston. As a group, we want to make this presentation personable, so we will be sharing stories about our working experience in public health. This diagram depicts an example of strategic workforce planning. It separates workforce planning nicely into 5 steps. In Step 1, the organization's strategic plans and activities to carry out goals are defined. During Step 2, the organization would assess the employee's skills and gaps to ensure that the organization has or can acquire the right people with the right skills. At this step, turnover and projected needs of the organization would be determined. Step 3 is where the identification and implementation of strategies to address skill and employment gaps occur. Progress towards achievement of the organization's strategic plan is also measured in this step. This can include further training, recruitment, and organizational restructuring to ensure that everything is on track. Step 4 is for ensuring that human resources are in order and that everyone understands what they're supposed to do in order to work towards the overall goals. Step 5 is really the maintenance stage. It involves continuous monitoring and assessing to improve the plan and identify any changes required to remain on course for goal achievement. With these steps, your organization is well on its way to achieving your public health goals. In Step 1 of the workforce planning wheel, setting strategic direction is the first component due to its important and effective HR planning in all organizations, including public health. This includes evidence-informed decision-making, population-based strategies, and effective communication. Interestingly, communication is repeated throughout the presentation, another demonstration of the importance of communication in human resource strategy. Diversity and inclusion is also key in strategic planning to ensure diverse needs are met. This includes disability, cultural and ethnic, and sexual orientation, to name a few. As well, in the interest of partnership and fiscal efficiency of programming, strategic directions are coordinated and aligned with federal, provincial, and territorial priorities. For example, Peel Region has a 10-year public health strategic plan that was revised and reported on the 5-year mark. Necessary adjustments were made heading into the second half of the 10-year plan. An interactive communication effort was carried out to ensure all public health staff were aware and could dialogue with management about the renewed plan. Many of you are probably familiar with the public health competencies because our Masters of Public Health program was built on them. The competencies are listed on the slide, and you can learn more about the different competencies with the link that's above. According to the Public Health Agency of Canada, core competencies are the essential knowledge, skills, and attitudes necessary for the practice of public health. They provide the building blocks for effective public health practice and the use of an overall public health approach. What some health units are currently doing is pilot testing a new human resource program to analyze employees' public health competencies. The program asks employees 100 questions about their position, knowledge, and skill set. Based off these answers, the program generates a competency profile to determine areas of strengths and areas for improvement based on your score. The results will be analyzed on an individual basis within teams and at the health agency-wide level. The idea is that based off the results, the program will help identify staff development and training needs, provide a rationale for securing funds to support workforce development, help identify the appropriate numbers and mix of public health workers in a given setting, and the competencies will help develop job descriptions, interview questions, and frameworks for evaluation and quality assurance. And this is to ensure that the right individual is hired for each position, and that he or she is competent enough to carry out their job requirements. Based off the competency profiles, employees can work with managers to seek out opportunities to build on their current competency level to fill any skills or gaps. If a competency is lacking on a team or at the agency level, training could be provided for their staff. Or if there's a person who excels in a certain competency area, they could be hired to fill this gap. As mentioned above, this is an analysis that provides an opportunity to identify areas of further training and development. This could be used for career development, for employees to take on future roles in the company, or, in other words, succession planning. We will talk about this later on in our presentation. In Step 3 of the Workforce Planning Wheel, it covers development and implementation of Workforce Action Plan. This includes planning for identification of strategies, plans to implement, and measurement plans to assess strategic progress. For example, recruiting, training, retraining, organizational restructuring, contracting out, succession planning, and technological enhancements. In a workforce that is constantly changing, including aging staff, succession planning is important. This also calls for strategies to enhance the smooth workings of new colleagues and intergenerational teams. In step 4, implementation of workforce action plans ensure that human and fiscal resources are in place, and that roles are understood and the necessary communication, marketing, and coordination is occurring to execute the plan and achieve strategic objectives. Step 5 of the Workforce Planning Wheel involves monitoring progress against milestones, assessing for continuous improvement purposes, and adjusting the plan to make course corrections and to address new workforce issues. Here again, we see communication being key in reporting back on the monitoring, evaluation, and revisions being made to the public health human resource strategy. For example, reviewing and revamping, and the overhaul of the Building Employee Satisfaction Survey at Peel Public Health as a result of staff feedback on the tool and process. We will talk about each heading further in detail in the next few slides. Performance management includes the establishment of performance goals and expectations, monitoring of progress against goals, and the provision of feedback and training development opportunities through an ongoing dialogue between managers and the employer. There are a number of performance management tools available to public health managers, such as the Ontario Public Health Association Competency-Based Performance Management Toolkit. This tool is used to facilitate the communication of performance objectives to employees and acts as a benchmark against which employee performance is evaluated. For example, in most public health units across Ontario, managers and employees meet to define performance objectives through using the SMART criteria. The objectives are then revisited either monthly or at the end of the review period. Thus, performance management in public health truly is an ongoing process. To perform well, employees need to know what is expected of them. The starting point is an up-to-date job description that describes the essential functions, tasks, and responsibilities of the job. It also outlines the general areas of knowledge and skills required of the employee to be successful in the job. Staff development, empowerment, and employee recognition strategies are also important components of performance management employed by public health organizations. For example, public health employees attend courses, trainings, and conferences that support their professional development. Outstanding performances are often rewarded. For example, Peel Public Health has the Together We Are Better award that is handed out to high achievers in the region. Also, KFLA Public Health has the Public Health Achievement and Recognition event held on an annual basis. Public health units, like many other organizations, have policies and procedures that guide employee discipline. Group 6 is going to discuss recruitment in detail, so for the specifics of our content, we will be focusing on reasons that attract us to working in a public health setting. Similarly, the reasons that attract us to work for public health are the same reasons we continue to work for public health. For this reason, we'll be discussing recruitment and retention together. It is important to note that these factors can be applied to any work environment, but we want to make this content more personal to public health. So I will be sharing some of our personal experiences with working in a public health setting in this section. In general, many individuals are attracted and continue to stay in a work environment that provides advancement opportunities. This refers to the amount of potential for movement to higher levels within the organization. This is also tied in with succession planning. It's the idea that you're given opportunities to build on your public health skills and to advance in your career or take on a new role. For example, some workplaces like Peel Region or KFLA, they're supportive of us in pursuing a Master's of Public Health. There are agency policies out there that allow us to receive financial reimbursement towards tuition payment. Constituent attachment refers to the degree of attachment an employee has in an organization with a manager, their co-workers, or members of the general public. I once had a manager who always scheduled team meetings over a lunch break. He would treat us all to lunch using his own money. As a team, we would all sit together and talk about our lives while we ate our lunch. By sharing a meal with one another, we had the opportunity to get to know each other a little bit better. This promoted team cohesion and made each member feel like they belonged on the team. Before I continue, I want to mention that having this type of manager is extremely rare and might only be unique to this one team that I worked on. I don't want to give the impression that all teams in public health are like this, because this might not be the case. Feelings like I belong on a team and at public health is one of the main reasons why I continue to work for them. Next, I'll talk about extrinsic rewards. This refers to your salary and benefits for your services in public health. In general, working for the government provides you with a great benefits package and a decent salary. For the most part, if you're a public health nurse or public health inspector, you make a similar amount to others in the same position with the same experience across the province. Flexible work arrangements refers to your schedule of work or your hours. Flexible work arrangements help promote work-life balance. Many health units offer flexible work arrangements. Some managers are flexible about your work schedule depending on the nature of your job. Many places of employment provide the opportunity for a compressed work week. Also, some places enable you to work from home. For example, if there is a snowstorm and it's unsafe for you to drive to work, there are policies that enable you to work from home. Organizational factors refers to an employee's perception about fairness and reward allocations among staff members and the agency. If an employee sees that everyone on the team gets treated fairly and equitably from their managers, this can encourage them to stay within the agency. Also, an organization's prestige or high reputation can also attract a person to work for that agency or continue to work for them. Lastly, job satisfaction or employee engagement refers to the idea that engaged employees are more committed, satisfied, and eager to give extra efforts to their employers to achieve company goals. Engagement also influences human resource goals such as retention, job performance, absenteeism, and recruitment. We'll talk about employee engagement later on in our presentation. As referenced earlier in the presentation, communication is an essential component of human resource strategies, especially in public health. As a matter of fact, communication is a core competency for every public health practitioner, including a human resource specialist. A comprehensive human resource communication plan establishes a strategy for sending messages, making announcements, and publishing information for a human resource department. It sets expectations about what types of information the health unit will distribute in the coming year. Without a detailed plan, employees and managers lack guidance in human resource functionings such as benefit administration, recruiting and hiring, performance management, rules for discipline, and training and development. Human resource specialists may use different media of communication depending on the information to be disseminated. For example, Peel Region, like many other health departments, use mainly the internet for job postings and emails for communication with staff. They are more likely to use face-to-face communication for discipline-related issues. Lastly, we'll be talking about employee engagement. Employee engagement, according to the Business Dictionary, is defined as the emotional connection an employee feels towards his or her employment organization, which tends to influence his or her behavior and level of effort in work-related activities. Employee engagement, not to be confused with employee happiness, captures a multidimensional approach of employees' overall work experience. Engaged employees are more committed, satisfied, and willing to provide extra efforts to achieve the goals of their organizations. A higher level of employee engagement also helps retain, recruit, and reduce absenteeism. Public health units, as well as private sector companies, implement surveys to measure employee engagement and job satisfaction in areas for growth. There are 3 dimensions of an engagement scale to measure employee engagement. In a nutshell, these dimensions are emotional, which consists of employee pride over their jobs, and feelings that the organizational values are consistent with their own. Rational, which relates to overall job satisfaction and the organization as a place to work, and behavior, employees' feelings about going to work, and inspiration for high job performance. We'd like to end our presentation with a quote. You can have the best strategy and the best building in the world, but if you don't have the hearts and minds of people who work with you, none of it comes to life. Thanks for listening to our presentation.